Parents have been anxiously waiting for the FDA to approve a COVID vaccine for children between the age of 5 and 11. Today, the U.S. moved a step closer after an FDA panel gave its endorsement.
Now, News reporter Denise Tudor is live in Montrose with more on that and when the FDA could make its final decision. Denise.
Well, David, in an historic vote, a government panel takes the first step in getting a COVID-19 vaccine into the arms of younger children. Do the benefits of this two-shot, lower-dose vaccine outweigh the risks in kids 5 to 11 years old? In a nearly unanimous vote, an FDA advisory panel said yes, but the committee recognized there's controversy.
I want to acknowledge the fact that there are strong feelings that have clearly been expressed by members of the public, both for and against the use of the Pfizer-BioNTech vaccine under emergency use authorization.
There were no cases of myocarditis in Pfizer's clinical trial of 2,200 children, but much of the conversation centered on whether younger children could also be at risk of this rare adverse event. Pediatric intensivist Dr. Rishma with Dignity Health Northridge says it's a question many parents ask.
You can always discuss it with your pediatrician. The cases that were mentioned in the adolescents, they were mild, they were resolved on their own, and there were no long-term effects.
Health officials laid out the great need to protect this age group. So far, more than 8,300 hospitalizations, about one-third requiring ICU stays, and one of the top 10 causes of death for this age group during this time.
Sadly, more than 700 children have died of COVID since this pandemic began.
As soon as the CDC signs off, pediatric doses will be shipped and are expected to be available around the end of this week.
We're used to vaccinating our children that come into our offices and to our hospitals. That's what we do. That's our objective, is always to make sure our children are safe.
Still some apprehension. A Kaiser Family Foundation survey finds roughly one-third of parents will wait and see before allowing their kids to receive the shot.
You know, it's just a little child. I don't know how quick I would be to jump on a decision to do that.
For others, it can't come soon enough.
If we can at least have them that extra layer of protection with the vaccine, that's what we're excited for.
Meantime, the LA City Council extended the deadline of the vaccine mandate for city employees. Mayor Eric Garcetti saying city employees who haven't gotten vaccinated by December 18th should be prepared to lose their jobs. LA City workers who do not show proof of vaccination will have to be tested twice for COVID at a cost of $65 per test, which will be taken out of their paycheck. And back to pediatric vaccines, we're waiting on the FDA to officially authorize the Pfizer vaccine for children. Then next week, it will go to the CDC panel and then to the CDC director. Reporting live, I'm Denise Tudor, ABC-7 Eyewitness News. Back to you, David and Colleen.
All right, Denise, thank you very much for that live report.